Hello and welcome to St. Mary's Medical Center Lap Band Seminar. My name is Jamie and I'm the Lap Band Coordinator at St. Mary's. I will be assisting you on your journey with the Lap Band. Presenting today are Dr. Adam Kramer and Dr. Brooke Red. Please remember to fill out the questionnaire after you watch the seminar and bring it with you to your first appointment. With that, I'll turn it over to Dr. Kramer.
Hi, I'm Dr. Adam Kramer. I'm one of the surgeons in Achieve Bariatrics, which is a division of Advanced Surgical Associates. I've been doing lap band surgery for about 2.5 years and been doing advanced laparoscopic surgery for about 13 years. Today we're going to discuss different options for bariatric surgery with a concentration mostly on the lap band procedure. The items that we're going to discuss are the trends and impacts of obesity, what can be done to treat obesity, including the different surgical options, and why to choose the lap band, the benefits and risks. We'll have some patient profiles as well, and then we'll talk about losing excess fat and preserving necessary tissue. And then we'll also touch on the cost of obesity and the affordability of surgery and some other patient resources and support. As far as the trends and impacts of obesity go, in the United States, over 72 million people are obese. Almost 23 million people suffer from type 2 diabetes, of which more than 85% of people with type 2 diabetes are overweight. And according to the Centers for Disease Control, 53% of obese adults in the United States were diabetic in 2007. These slides are kind of interesting because they show the trend and the increase in the weight of our nation over time. On the far left side is a slide from 1990 showing the majority of the country is between 15 to 19% obese, with a few states that were less than that. And as you progress to 2008, you can see that there are certain states in our country that are greater than 30% obesity. We also see about obesity all the time in the news, whether it's our First Lady's anti-obesity campaign or movies like Super Size Me. And in the past, the perception was that obesity was seen as a weakness or failure on the patient's part, and diet and exercise were the only things that were prescribed. Weight loss surgery was viewed as dangerous and extreme. Now, obesity is considered as a disease with serious health risks. Diet and exercise are still the cornerstone of obesity treatment, but surgery is also accepted and proven treatment for obesity. Surgical treatment is appropriate for qualified patients. And bariatric surgery is a proven weight loss method. Now today we're going to discuss people who qualify for this surgery who would be mostly in the severely obese to morbidly obese categories, although there have been procedures approved for patients with a BMI as low as 30. BMI is a measure based on height and weight. It's a way to standardize calculations for patients based on their height and weight. And you can see the chart here, which shows across the top your weight in pounds versus height on the vertical axis there. And if you match up your height with your weight, you can get your BMI. The people that we're considering for surgery are people usually in the bottom two categories. They're severely obese and morbidly obese, or a BMI of greater than 35. We'll go into who would qualify for surgery later on in the seminar. So the impacts of obesity, there's risk factors associated with obesity, including type 2 diabetes, heart disease, high cholesterol, strokes, hypertension, non-alcoholic fatty liver disease, gallbladder disease, osteoarthritis, Sleep apnea and other breathing problems, and certain forms of cancer have increased risk with obesity as well. Also complications related to pregnancy and menstrual irregularities. There's also other associations with obesity, which include asthma, pregnancy complications, menstrual irregularities, excessive hair growth, urine leakage, depression, heartburn, increased surgical risk, increased mortality. So treating obesity can have multiple health benefits. The impact of obesity, there's also the social and economic impact, which includes trying to make a good impression, dealing with judgmental behavior, like especially on airplanes. I've had a lot of patients complain about the looks they get on airplanes. Compromised health and premature aging. Also, as far as economics go, as weight increases, so does medical spending. So you have increased personal spending on prescriptions and weight loss products as well. You can see the graph there that shows the weight-related medical costs with overweight people with a BMI of 25 to 30 versus patients with a BMI greater than 30. Patients can recover the procedure expenses. 99% of laparoscopic adjustable gastric band expenditures can be recovered within 10 years. 100% of expenditures for diabetes as a comorbidity can be recovered within 4 years and 3 months. The net cost of coverage for a laparoscopic gastric band was reduced to 0 by approximately 4 years after the band placement for those with diabetes. Now, what can be done to treat obesity? We've already talked about dietary intervention. Reduction of about 10% of body weight at 6 months is a healthy weight loss, but diets are prone to failure for many reasons. Physical activity alone does not lead to weight loss. Behavior modification requires ongoing professional contact, and the failure rate can also be very high. Drug treatments, weight is typically regained as soon as you stop taking those medications, plus they have some side effects. Weight loss surgery in the severely obese patient is the most effective approach for long-term weight loss. There's 3 different surgical options that we're going to discuss today. The first is the laparoscopic adjustable gastric banding, or LAGB, and in particular the lap band AP system, which is the system that we use. Also, gastric bypass, or the Roux-en-Y, or RYGB, and then the third would be the sleeve gastrectomy, which is a newer procedure that's become much more popular recently. So here's how the different options work. The laparoscopic adjustable gastric band, as you can see here, there's a small band that's placed around the upper portion of the stomach, which limits how much food passes through. This is a restrictive procedure. And then you can see that there's a small catheter attached to that band, which goes out to a port which is implanted on the abdominal wall, so we can adjust the band to make it tighter or looser as needed. The next procedure is the gastric bypass, where you have both a malabsorptive and a restrictive procedure. The stomach is stapled and the small intestines is rerouted to bypass the majority of the small intestines. And then the third procedure is the laparoscopic sleeve gastrectomy, where a portion of the stomach is removed, a very large portion, which basically leaves a long, thin tube. So this is a restrictive procedure as well, but there is a large staple line and a portion of the stomach that can never be returned to you. How the different procedures compare. This slide shows lap band compared to gastric bypass. We talk about excess weight loss. or EWL, which is the amount of weight that somebody loses over their ideal weight. And in this case, you can see that the lap band has a 45.4% plus or minus 20% excess weight loss at 4 years, versus the gastric bypass, which has a higher 68.4% plus or minus 16 at 4 years. The sleeve gastrectomy has a much higher initial weight loss, 77.5% at 3 years. However, at 6 years out, the majority of those patients gain weight back, and the excess weight loss is only 53.3, which is close to the lap band as well. Now, the other thing to consider is complications associated with these procedures. With the lap band, total complications are 6.3% versus 24.3 with gastric bypass and 17.7 with sleeve gastrectomy. The laparoscopic adjustable gastric banding shows favorable safety outcomes compared to the Roux-en-Y sleeve. Complications from lap band include things like band slippage or erosion of the band through the stomach, blockage of the stoma, and also vomiting. 6.3% of patients experienced at least one complication with the lap band. Patients lost a median of just 17.5% fat-free mass. And that's the mass that is necessary in our body, like minerals that are important for cartilage and bone and necessary fats. And that compares to the gastric bypass, where people lose a median of 31.3% of their fat-free mass. Complications of the gastric bypass include pulmonary embolus, leakage, hernias, ulcers, bowel obstructions, mineral and vitamin deficiencies which require daily replacement, and dumping syndrome. The complications of the sleeve gastrectomy are similar, including leakage, stenosis, suture line bleeding, incisional hernias, and increased gastroesophageal reflux. The length of stay and return to normal activity for the lap band system versus gastric bypass. Hospital stay in our program is usually just over 1 day. We know that people can go home the same day in other programs, but we elect to keep our patients here overnight after their gastric banding surgery. The bypass surgery, typically people stay 2 to 3 days in the hospital. The days to normal activity are significantly less with the lap band system, and the total length of recovery is about 2 to 3 weeks with the lap band and a little bit longer with the gastric bypass. So the advantages of the gastric bypass has rapid initial weight loss. There's no implants required. The disadvantages are that the stomach is stapled and the intestines are rerouted. There's higher complication rates. Dumping syndrome can occur. It's not adjustable, and it's very difficult to reverse if there was a need to reverse it. There's longer mean hospital stay and recovery, and vitamin deficiencies occur which require daily replacement. The next slide I'm going to show is an animation of the gastric bypass procedure, and we'll discuss it as it goes through the procedure. This just shows the esophagus and stomach, large intestines. Initially, there's cutting and stapling of the stomach to make a small pouch. And then the small intestines is also cut and rerouted to go up to that small pouch and then bypass a long segment of the small intestines. The next procedure is the sleeve gastrectomy. This again has rapid initial weight loss. There's no implant required. The disadvantages are that it does require stomach stapling. The complication rates are higher. It's non-adjustable and it's absolutely not reversible. Once that segment of your stomach is removed, it can't be replaced. It does have a longer hospital stay and a slightly longer recovery as well. There'll be another animation in the next slide. This slide shows, again, the same anatomy. The procedure involves stapling and removing a large segment of the intestines, leaving a sleeve-like remnant. The remainder of that stomach is discarded. The lap band procedure, the advantages are that there's no stapling of the stomach or reconnecting of intestines. There's a steady, healthy weight loss. There's no dumping syndrome. This is an adjustable procedure and it is fully reversible, although we don't recommend reversing the lap band unless you have some sort of complication that would require that, or some sort of another medical condition that would require us to remove it. There's much lower complication rates versus gastric bypass and sleeve gastrectomy, and the procedure can be performed as an outpatient. Again, we perform this procedure with a one-night hospital stay. The disadvantages, and these are things that I don't necessarily consider disadvantages, are that it's a gradual and long-term weight loss, and then there is an implanted medical device. The next slide will show an animation of how the lap band is placed. Again, we see the same anatomy. The lap band is placed around the upper portion of the stomach, just below the gastroesophageal junction. It's attached to a port which is placed on the abdominal wall, and then we can adjust that port using a small needle to make the band tighter or looser depending on the patient's needs. That slows the food going into the stomach and tricks the body into thinking that you're full, and that way patients stay full longer and eat less. As this slide shows, it can be performed laparoscopically. It's actually through 5 small incisions instead of 1 like it says on the slide. The band is placed around the upper part of the stomach, small pouch is created, the stomach holds less food, and patients eat less but feel full. The benefits of an adjustable procedure is that there's no stapling of the stomach, there's gradual healthy weight loss and long-term weight loss. At 5 years, the excess weight loss is approximately 55% in one study. So the next step is to talk about why we choose the lap band system, and for that I'm going to introduce Dr. Brooke Redd, my partner, and he'll discuss this further.
I'm Dr. Brooke Redd, the other member of Achieve Bariatrics and one of the members of Advanced Surgical Associates as Dr. Kramer. I've been doing bariatric surgery since 2003 and lap bands here in Kansas City since 2010. Our second half of the seminar, we're going to talk about why the lap band, some of the results and safety of the band itself. As Dr. Kramer mentioned, the excess weight loss is the weight loss you lose above your ideal body weight. So if you're starting at your ideal body weight at 0, it's the weight above that you weigh. For example, a BMI of 40 is roughly 100 pounds over your ideal body weight. So an excess weight loss of 50% is roughly 50 pounds. In this first study, we'll look at several. Over half the patients experienced greater than 50% excess weight loss at 2 years, and an average of 53% at 2 years in this group of patients. In another study, going out to 1 year, and this is with the newer band, the patients experienced a 64% weight loss, excess weight loss at 1 year. And at 3 years, just showing the sustainability of a lap band, 62% weight loss at 3 years after band placement. Now, another way to look at this is the actual pounds that were lost. This is my first 30 patients, and the average weight loss of those 30 patients after having their band placed. And you can see that the numbers there, and at similar to the other study, so at 12 months or 1 year is about 56 pounds, and at 15 months, 62 pounds was the average weight loss for my first 30 patients. Now, excess weight loss, it's important and it's good for your health, as you know, but I also see things increase fertility and favorable pregnancy outcomes with weight loss. Physical abilities improve, quality of life improves, improved body image, less depression after surgery and weight loss, and also resolution of gastroesophageal reflux disease. And the reflux results can be pretty impressive. If you have a hiatal hernia, we can fix that at the same time as placing your band. And in 90% of patients, the symptoms completely went away or were vastly improved. A small percentage had no change, and a very small percentage had aggravation of the reflux. And I think a lot of that aggravation was due to earlier studies and early time where we weren't really actively looking for hiatal hernias to fix at the same time. Other diseases that lap band improves with weight loss, diabetes in particular, 80% roughly of diabetes can be cured or gone after surgery and weight loss, which is very comparable to the gastric bypass, which, as Dr. Kramer mentioned, is a more invasive and more dangerous operation. Now, why the lap band? Again, it's a proven safe procedure with a low complication and mortality or death rate. Significant weight loss does occur after a lap band. The weight loss is sustained, going to last over a long period of time, and a big portion of that, I believe, is due to the adjustability of the band. So as time goes on, we can put fluid in or take fluid out if we need to help you to continue to lose weight. And it's a quality weight loss, again, losing fat, not the necessary mass that you need. And we'll get into that a little bit more later. Look at a few examples, some patients who have had a band. After we look at who's a candidate. You need to be at least 18. A BMI of 30 is doable for a band. It is approved by the FDA. However, most insurances don't cover the lap band for a BMI of 30 to 35, but BMI of 40, most insurances do, as well as a BMI of 35 to 40 with some health-related problems to obesity like diabetes, hypertension, and sleep apnea. You have to have tried to lose weight for a period of time. Most insurances require you to have a physician-supervised weight loss plan, and Dr. Kramer and I can do that for you, or as well to meet those requirements. You need to set a lifelong goal to change the way you eat and exercise and be committed to that. Most insurances also require a dietitian consult and psychological evaluation. And the big important part is being willing to do follow-up. Any bariatric procedure needs intense follow-up afterwards, and we do that as well. In our office is a big part of that, as well as our support groups right here at St. Mary's. Some examples. This gal, as you can see, her concern was to be with her kids and do things with them, couldn't play and go on rides with them. And after lap band and weight loss, she was able to show and do cool stuff with her kids and just be healthier because of that. This guy here had type 2 diabetes and didn't want to deal with that for the rest of his life as one motivating factor. Had a band placed, lost weight, and he's healthier, feeling better, and freely able to exercise. And then this lady tried all kinds of diets, as have many of you, losing weight, gaining it back, and just didn't want to keep doing that. Had a lap band, lost weight, now is able to go out and do things she couldn't do before, feeling happier and better about herself as well. Back to the necessary weight loss. You'll lose more than fat with weight loss surgery. Some types of fat you need to keep, other body mass you need to keep, bone, muscle, cartilage, and other fluids you want to hold on to, and tiny elements, nutrients and hormones as well. Healthy weight loss, slow and gradual, eliminating excess fat, not bone and muscle. If weight loss is too fast, you'll lose necessary mass that can have a harming effect on the rest of your body. Now, with healthy, slower weight loss, it's similar to diet and exercise alone, losing fat helping preserve the necessary mass. Rapid weight loss, example with gastric bypass, excess fat, but you also lose more muscle, bone, and necessary fat compared to a band, as well as nutrients and minerals which need to be replaced, and that it's much more difficult to do with the bypass because of the malabsorptive effect of that procedure. So the type of surgery will have a big impact on your health. Another way to look at that with gastric bypass on the right versus a band on the left, the amount of necessary mass loss was almost twice as much in the gastric bypass group, which the effect can be to harm organs, hormone levels, and particularly bones and losing calcium there. Only 8% of gastric band patients experience an unhealthy loss of weight in this study versus 100% of the gastric bypass patients. Now they would say 2 pounds per week is a goal. We shoot for a pound a week in our program. I think is a really good goal in the long term. So the first couple weeks in our program, you'll be on clear liquids after the band is placed to get used to the band. With that, as well as losing a pound a week, it's pretty easy to lose 60 pounds in a year. And if you lost a pound a week the next year, that'd be another 50. So it's not unreasonable to lose 100 pounds in 2 years after a band placement. It does require quite a bit of amount of work, but you can do it. The band has been used worldwide for over 20 years. We have a long experience of drawing from Europe and Australia, as well as here in the U.S. when it was started to be used in 2001. And so with this group of people that do bands, we share information, we share data with each other, and continue to learn how to use the band, how to manage the band after surgery to help you continue to lose weight. The band comes in 2 sizes, so if we need a longer band or a bigger band for some stomachs to fit right, we can use the larger design. And then the Omniform technology is an even distribution of the balloon around the upper part of your stomach. It's a little bit wider than the old band, so with the new band you're going to even pressure on your stomach, less likely to have a problem, and the weight loss is continuing to be better. And then the adjustment part, as you saw in the animation of accessing the port with a needle in the office, most of the time we can add fluid to make it a little bit tighter to continue to help you lose weight over time as you need that. Now, the cost of being obese versus the affordability of surgery. With weight loss, as Dr. Kramer mentioned, medical expenses go up. Medications, office visits, copay, lab work, specialists, all those expenses go up with your weight, as well as grocery and dining costs go up as well. Prescription payments go up, and for employers, this is more important, but more obese people lose more days at work than non-obese employees do. So that costs quickly add up with obesity. Now, who will cover this? You need to ask your insurance company some specific questions, not just do you cover weight loss surgery, particularly do you cover the band, and then what are the requirements that they will ask you to do before they will cover this kind of procedure. And we in our office can help you work through that. Now, there are some online support tools and online educational things for you to look at through lapband.com. And this can be a great addition to helping you on your weight loss journey, as well as the things we do in our office and our support group. You can do a lot of those things online as well anytime you want. The personal journal, you can journal, keep track of your personal journey as you lose weight, celebrate successes. You can find recipes, share recipes with other band patients, make a movie of yourself if you want, all these things to help you along that journey. In summary, as we saw, obesity is a growing problem worldwide, not just here in the U.S., and surgery continues to be the most effective treatment for patients who are morbidly obese. Our goal in weight loss surgery is to have a healthier, happier you, and we here at St. Mary's and Achieve Bariatrics want to help you do that. Next steps, you can go to lapband.com, get more information. You can go to our website at our office as well and get more information. Ask people who've had a band or other weight loss surgery what they think about that. And write down questions that you have if you want to come to our office and bring them with you. And don't forget to fill out the questionnaire at the end of the seminar. Thank you for your time.